Hi, I'm Randy Neiswonger, CEO of Community Hospital. Welcome to this edition of Community Beat. I'm very happy to have two of our newer physicians with us, surgeons. Would you mind introducing yourself to our viewing audience?
No, not at all. So I'm Dominic Harris, one of the neurosurgery doctors here that just started last July. I'm glad to be here.
And I'm Dr. Joshua Simon. I also started last summer in September. Thrilled to be here.
Yeah, thank you guys. You know, honestly, one of our haloing service line is our neurosciences service line. Can you tell the viewing audience maybe areas of focus for yourselves so that they have some awareness?
Absolutely. So I've done a fellowship both in cerebral vascular, endovascular, as well as spine. And one of the exciting things that drew me to Powers Health is that the reputation it's had in excellence in stroke care. One thing that Randy brought up in my meetings with him is that Northwest Indiana historically has had a need for specialized care and especially in more complex neurovascular issues, either ruptured aneurysms, arteriovenous malformations, or even just hemorrhagic strokes that come in. And there was a need for it, certainly in this area where patients otherwise have to travel far, either in the city or go somewhere else for more specialized care. So what drew me to Powers Health was the opportunity not only to build a practice here as I'm starting off in neurosurgery, but to make a real difference.
You know, it's been wonderful having started here, and I was started here just coming out of residency, where I was at Loyola University Medical Center in Maywood, just outside Chicago. My specialty is largely in spine. I also do a fair amount of cranial and brain tumors. I also do peripheral nerve surgery, so that's carpal tunnels, ulnar nerve surgery, and common peroneal nerve decompressions, which are at near the knee. I found that was something that really had not been frequently done here prior to my arrival, and I've been excited to help start to build up that program. I was really immediately impressed upon meeting the executive board and just finding out how long everyone had been here and how committed they were to this community. And then just on my brief tour of the hospital that day, everyone I talked to just they have such a commitment to this community, and that was honestly just such a shock to me. I've been so mobile and moving from here and there throughout my life, and to find somewhere that everyone is just dedicated to serving one community, I thought was just endearing.
I mean, I can't impress upon our viewing audience enough the importance of the endovascular approach that you take, Dr. Harris. That's something that really is necessary to have our comprehensive stroke services. And then Dr. Simon, just kind of re-echoing something that you said, you know, we do have a developing brain tumor program here, which is so important. And then to add in the peripheral nerve stuff that you were talking about, carpal tunnel, a very common issue in our community that is largely served by your area of specialty. So I'm really grateful for that. I know that there's a lot of ways to enter into your practice, but is there a special way that you want to make sure that we articulate here today?
We deal with a lot of common pathology, whether it's coming from back pain or more complex pathology that's going on in the brain. Typically, I would say that the primary care doctor traditionally is the main gatekeeper, but sometimes when it comes to neurosurgical disease, a lot of the time the primary care doctor doesn't really know where to start or where to send patients. So I find that a lot of patients have been seeking their own consultation with us as they see fit, and that works for them, and I think that's fine too. Our office is here to help you wade through the very complex machinations that goes on in healthcare. So even though you may not know whether you need to see a neurosurgeon, you can always give our office a call, and we'll be happy to see you and help you to get to where you need to go next.
Dr. Simon, any closing thoughts that you want to give to the viewing audience?
Yeah, very well said. And all I'd add is, it seems very stressful to come and see a neurosurgeon. We recognize that anxiety that patients come in with when they're seeing one of us for the first time. I hope you could tell we're just two normal guys who just really want to help you out and help the community out. And we're motivated to try to avoid surgery if at all possible. But if that's the case, and if you need it, then that's something that we approach, and we hold your hand through that process. We work with your doctors to make sure it's as seamless a process as it possibly can be, and then we have the privilege of taking care of you while you're in the hospital, and of course seeing us afterward. And it's we build a relationship together that we'd love to meet you if it's something that we can help you with.
Yeah, thank you. You kind of stole my thunder on my closing thoughts too. I
Yeah.
just wanted to, kind of reemphasize the fact that you guys are just so down to earth, and it's so easy to work with you, and I know that translates to a really great bedside experience for our patients. So I want to thank you for that. I'm grateful for your time today. I'm grateful for your time today, and we're going to see you guys next time on Community Beat.